Hey folks, Matthew Weiss here, and welcome to Nobody Likes a Moderate, the show which is not a show where I alienate my clients by sharing my political opinion. Anyway, today's episode is going to be about Obamacare. Should it remain institutionalized here in America, or should it be repealed? This was brought on by the recent Daraprim controversy, where the new CEO decided to take it from $13.50 a pill and make it $750 a pill, which is really hard to not see as profiteering. But I thought I'd take a bigger look at the overall picture, because this is actually something that's been fairly common over the last few years. I mean, just in general, medical providers have been raising their rates consistently ever since the inception of medical providers. But in the recent years, we've seen a lot of increase. We've seen our insurance premiums go way, way up. And a lot of this is spurred on by the Affordable Care Act. So I want to kind of get into that and break down some of the ideas. And I think it's important to look at the Affordable Care Act both in terms of the economic issues of it and the social issues of it, because there's sort of two ideas at play. So the Affordable Care Act basically requires people to buy insurance by law. Effectively, it increases the money pool that insurance companies have in order to pay for people's health care. In addition, the ACA makes it illegal for insurance companies to deny anyone coverage, and it then compensates for whatever the monetary loss would be by issuing subsidies from the federal government. So to understand the economic implications, we need to understand what's contributing to our excessive expenses that we have in America. Number one, medical treatment is viewed as a for-profit service where hospitals are incentivized to do stuff rather than get things done. There's also poor communication between different medical organizations, and that leads to a lot of repeat or unnecessary testing. Second, drugs are extremely expensive. This is because drugs are sold to so many buyers in the US. That means each individual buyer has less leverage in negotiating a price, and leverage is a very, very important concept here. Third, we don't have nonprofit insurers outside of Medicare Medicaid, and it is currently illegal for Medicare to negotiate with pharmaceutical companies. Side note, Democrats want to change this, and as a personal note, I totally agree. Fourth, the cost of medical devices is simply passed on to the patient because patients have very, very little negotiating power at all. In fact, the only leverage that ultimately comes down to the patient is the inability to pay. If a person doesn't have the existing resources, then the companies that provide healthcare have to lower cost. And that's really it. The economic problem with the ACA is that it puts the burden of price on a wider field. By making it easier to foot the bill, it effectively gives the providers more room to simply raise their prices, which is why we are seeing insurance costs just consistently rising every year, because drug prices are rising and device companies' pricing is going to rise, and there's going to be more R&D, which is great but also costly, and there's going to be more startups, which again is great but is costly. So economically, the ACA will almost certainly assist in the cost of healthcare going up, because it doesn't solve the underlying issue of leverage. Now, socially speaking, it does solve the issue of people who desperately need healthcare not being able to get it outside of an ER. It does solve the problem of mitigating the extreme expense people who have serious health conditions face. It does solve the problem of people being denied coverage. If the government's job is to protect us, well, cardiovascular disease kills as many people as the 9/11 attack did every single year, and that's just heart disease alone. So, I'm very much divided in terms of the efficiency of the ACA. Socially speaking, I think it is a huge improvement over what we had before, because we're not leaving people hanging out to dry. And that's not who we are as Americans. We don't do that. But it does suck for us economically. It's not a step in the right direction in terms of actually solving the problem of leverage. And when a lot of people talk about things like a single payer system or, raising the negotiating power, a lot of times people who like the single payer system model like it because it establishes a national healthcare organization of some sort, and that national healthcare organization can act as one brain to do the negotiating. And when you have one brain doing the negotiating, if they say, no, we won't buy it at this price, suddenly that one stronghold force has way more leverage than, 300 million Americans, with one of them going, I can't pay for it, and the other one's going, we have to pay for it. So that's really the thing. Now, should it be repealed? Right now, I don't think we can ethically. What we had before just wasn't right, because it was leaving people effectively to suffer. I think that stepping toward getting rid of the ACA would be great, but we need to replace it with a system that can somehow solve the problem of leverage and also effectively work in a transitional period where we switch over and people can still be cared for when they need it. So it's not a matter of simply do we keep it or do we get rid of it. It's if we want to get rid of it because it's not economically sound for us, what do we do as a means of replacing it, keeping in mind the needs of the people of America? So that's my opinion on it. If you don't like that opinion, that's cool. Totally understandable. You know why at this point. It's because nobody likes a moderate. Till next time.